What's up, respiratory world? We got an 8mm Portex. In the L-Tex, typically, you might have a patient downsize to a Portex after they had a Shiley, due to Shiley giving a little bit larger diameter. This one has that transparent flange, so you have to look real closely to get the identification of the tube size. You have your obturator, of course. Then you're in the cannula. This is a pretty good size. You can suction pretty easily through this. A 14 French can pass pretty good through this opening in the tubing. Sometimes it comes with a cap because, you know, these cuffless trachs are usually used to facilitate patients who are weaned off mechanical ventilation, because you can't use a mechanical ventilator with a patient who does not have a poly balloon on their trach. So usually after they've been weaned from mechanical ventilation, they're on airsoft therapy for however long the patient, doctors feel like it's beneficial. They want to give them a passenger valve. They give them a passenger valve. They may not be able to breathe around the poly balloon. The orifice may be too big. They want to put a passenger valve on it. They might downsize them from a Shiley, which is sometimes a little bit larger diameter. This is a size 8, so this is a pretty large Portex. But they'll try them with the passenger valve. To tolerate the passenger valve for a number of days, they might, just cap them, occlude the end of the trach, nasal cannula through the nose for air, for oxygenation, and see how well they tolerate it after the passenger valve trial is passed, of course. Yeah, so this is our Portex. Always remember to keep your obturator. Usually if you're going to put a new trach in, you're going to have an obturator that comes with it. So, but we always usually keep the obturator by the bed, just in case we got to put the trach back into place. And, change your cannulars pretty frequently to maintain patency of the airway, because if you so happen to have a patient and the cannula is not in place and they become, secretions fill up the tube and you can't pass suction catheter. If you don't have an obturator, inner cannula in, if you have an inner cannula in, you can just remove the inner cannula and, change it out for the patency of the airway. But if you don't, then you're probably gonna have more of an issue than you want to have.